Welcome to the Deep Dive, where we take a stack of your sources, articles, research, our own notes, and really pull out those essential nuggets of knowledge. Think of it as your shortcut to being truly well-informed, maybe with some surprising facts, and hopefully just enough humor to keep you hooked. Today, we're taking a truly fascinating deep dive into a common procedure, but one that's surprisingly complex: equine castration. We've got some really comprehensive sources here laying out everything from, those crucial preoperative considerations to the real nitty-gritty of surgical techniques, and importantly, what you need to watch out for post-op.
Right, and our mission today really is to cut through some of the medical jargon, the practical details, and just give you a complete picture. We want you to understand not just the what, but the why behind this really important procedure for male horses. So whether you're already a horse owner or maybe thinking about becoming one, or perhaps you're just, curious about veterinary science, this deep dive is definitely for you.
All right, let's get into it then. Let's unpack this procedure. So let's start right at the basics. What exactly is equine castration, and why is it done so often? It seems like one of the most common surgeries for male horses.
It is, yeah. At its core, it's pretty straightforward, the surgical removal of the testicles. But what's fascinating is how fundamentally it can reshape a horse's life. The main reasons, mostly behavioral modification. It generally makes gelding safer, much more manageable for handling, for training, and just for living alongside other horses. And of course, the other big one is preventing unwanted breeding. That's key.
So it really boils down to safety and practicality in most cases then.
Largely, yes. It makes managing horses in domestic settings, farms, stables, much easier and safer for everyone involved, including the horses themselves.
That makes sense. It sounds almost fundamental for responsible horse ownership in many situations. But are there ever times when an owner might actually want to keep those stallion behaviors? And what are the trade-offs there?
Oh, absolutely. That's a great question. I mean, obviously, breeders need stallions to continue their lines. That's essential. But even outside of pure breeding programs, some owners might value the let's say the presence, the spirit, the specific athleticism that sometimes comes with an intact male.
Ah, okay.
The trade-off, though, it's significant. You're often dealing with increased risk, not just potential aggression towards handlers or other horses, which is serious, but also the need for, specialized facilities and much more intensive management.
Right. More work, more cost.
Exactly. It can be costly, demanding. So it really becomes a decision based on what the horse is going to be used for and, frankly, the owner's capacity and experience.
Okay, so the why is often about safety, manageability, but the success, it seems, really hinges on what happens before the surgery even starts. What are those crucial pre-op things our sources really stress?
Yes. The preparation phase is absolutely critical. You can't overstate it. A thorough veterinary assessment is step one. And the first thing they'll look at is age. Typically, castration is done somewhere between 6 months and 2 years old, or basically once both testicles have fully descended. But here's something really interesting the sources point out. If you delay castration, say in an older stallion, some of those learned stallion-like behaviors, they might actually persist even after he's gelded, even without the testosterone driving them.
Wow, really? That's fascinating. So it's not just hormones then, it's like learned habits.
Exactly. It suggests that behavior isn't purely chemical. Some of it becomes deeply ingrained. It kind of challenges how we think about instinct versus habit in horses, doesn't it?
It really does. So what does that mean for managing an older horse that's been gelded late?
Well, it means you might have a horse that's technically a gelding, hormonally speaking, but he still might try to herd mares or mount other horses or show, aggressive dominance displays. So for owners, it means you might still need to manage those ingrained patterns with careful handling, consistent training, almost as if you were still partly a stallion, even though the surgery is done.
Gotcha. Okay, so age and behavior patterns. What else is on that pre-op checklist?
Well, next up, and this is crucial, is testicular descent. Both testicles absolutely must be fully descended into the scrotum. If one or both are held up higher, that's called cryptorchidism. It means a retained testicle. And that makes the surgery much more complicated.
How so?
It often requires general anesthesia, maybe even specialized techniques like laparoscopy, usually at a referral hospital, not typically something done in the field. And importantly, these cryptorchid horses, they still produce testosterone from that retained testicle, so they act just like stallions.
Okay, that's a big difference.
Huge difference. Then, of course, there's the horse's overall health status. You need a healthy horse. No signs of illness, no fever, no cough or respiratory issues. Lab work should be normal too. And vaccination status. This one's critical, especially for tetanus, The bacteria, Clostridium tetani, it's everywhere in the soil, literally
Right.
everywhere.
Nasty stuff.
Very nasty, and it loves surgical sites. So a tetanus booster before or at the time of surgery is absolutely vital. Non-negotiable, really.
Makes sense.
Also, a good deworming program contributes to overall health, making sure the horse is in the best possible shape.
Mm.
And finally, you think about timing and environment. Spring and autumn, often the best times for field castrations. Fewer flies buzzing around, which lowers infection risk. Less mud, too, which helps with hygiene.
Good point about the flies.
Definitely. And the location itself, whether it's out in a field, a clean barn aisle, or a proper clinic setting, it needs to be as clean and safe as possible. Minimize dust, debris, anything that could contaminate the site.
Okay, so that's a lot of careful prep work. Once all that's sorted, let's talk about the surgery itself. Our sources mention different ways of doing it. How do vets decide which technique to use?
Right, so the techniques that broadly fall into a couple of main categories.
Hmm.
The first big division is based on whether or not you cut into something called the vaginal tunic. That's the fibrous sac around the testicle. So you have open or closed techniques. And then the other factor is whether the horse is standing up or lying down. So standing or recumbent castration.
Open versus closed, standing versus lying down. Okay. It sounds like there are pros and cons to each, maybe almost a philosophical choice for the vet.
You could sort of see it that way, yeah. It's about weighing the risks and benefits for that specific horse in that specific situation. Do you go for the simpler, maybe quicker field approach with the open technique, knowing drainage is good, but there's that small risk of evisceration?
Evisceration, that sounds bad.
It is. It's when abdominal contents come out. Or do you opt for the closed technique, which almost eliminates that specific risk, but usually means general anesthesia and a more involved procedure?
Tell me more about the open castration. That's the common field one you said.
Yes, most common for field settings.
Hmm.
The vet makes an incision over each testicle, cuts through the skin, and then through that vaginal tunic we mentioned. This exposes the testicle and the spermatic cord directly. Then they use a special tool, an emasculator, to crush and cut the cord. And importantly, those scrotal incisions, they're left open.
Open, why?
For drainage, it's crucial. It lets any fluid, blood, serum drain out freely, which helps prevent swelling and infection.
Okay, so advantages are good visualization for the vet, great drainage.
Right, and it can often be done standing, with heavy sedation and local anesthetic, avoiding general anesthesia risks.
But the disadvantage is that evisceration risk.
Exactly, that's the main one. Because you've opened that tunic, there's a direct pathway, potentially from the abdomen. It's more common in foals, ponies, some draft breeds, horses that might naturally have wider inguinal rings, the openings the testicles descend through.
Okay. And you mentioned a theoretical peritonitis risk, too.
Yes, an infection inside the abdomen. It's rare with open castration, but theoretically possible since you've opened that connection.
Right. So what about the closed castration, then? How does that differ?
So with the closed technique, the vet removes the testicle with its surrounding vaginal tunic still intact. They don't cut into the tunic itself. Instead, they place a ligature, basically a surgical tie or suture, tightly around the entire spermatic cord and the tunic, high up, before using the emasculator below the tie. The scrotal incision might be left open or sometimes partially closed.
And the big advantage there is?
Significantly reducing that risk of evisceration. Because the tunic remains sealed, it keeps the abdominal cavity closed off. That's why it's often the preferred method for foals, donkeys, or any horse suspected of having those wider inguinal rings.
Makes sense. Safer in that specific way.
Definitely. It also means a lower risk of peritonitis.
Yeah.
Downsides. Well, it requires more careful, precise dissection. It's usually done under general anesthesia, typically in a more sterile clinic-type setting. And there's a slight risk of something called a hydrocele later on, fluid buildup, if it's not done just right.
Okay, that covers open versus closed. Now, standing versus lying down. Tell me about standing castration.
Okay, so standing castration. The horse is awake but heavily sedated, and they use local anesthetic blocks around the surgical area. It's almost always an open technique performed this way.
Advantages.
The biggest one is avoiding general anesthesia. That means avoiding the costs and, more importantly, the potential risks associated with putting a horse completely under. Recovery from sedation is usually faster, too.
But there must be downsides, too.
Oh, sure. There's definitely an increased risk to the veterinarian and the handlers if the horse were to react suddenly or move unexpectedly, despite the sedation. It can also be harder to control bleeding effectively if it occurs, and it's generally not the method for cryptorchids or horses with those large inguinal rings we talked about. You need a pretty calm, cooperative horse for it to be a good option.
Right. Safety for the humans involved is key, so the alternative is recumbent castration.
Exactly. Recumbent means the horse is lying down fully under general anesthesia, on its side or sometimes on its back. And you could do either an open or a closed technique this way.
Advantages here seem obvious then. Safety.
Primarily safety for the surgical team, yes. Much more controlled environment. It also allows for better visualization of the surgical field, more precision, and better hemostasis, stopping any bleeding. Plus, it's the necessary approach for cryptorchid surgeries.
Disadvantages must be the anesthesia itself.
Correct. The main drawbacks are the inherent risks that always come with general anesthesia in horses, potential complications during the procedure, or issues during recovery, like muscle or nerve damage, though vets take many precautions to minimize these.
Okay, that gives a really clear picture of the main approaches, but you mentioned specialized tools earlier. Our sources highlighted one in particular, the Henderson castration instrument. You said it uses a drill. That sounds wild.
It does sound a bit unusual, doesn't it? But it's quite an ingenious tool, actually. It uses a closed technique approach, but the method is unique.
Yeah.
The instrument clamps onto the spermatic cord, still within the tunic, and it's attached to a cordless drill. The drill then twists the cord fairly slowly in a clockwise direction.
It twists it.
Yeah, it keeps twisting until the cord fatigues and basically severs itself. The twisting action creates this really tightly coiled stump of cord, and that compression is what provides the hemostasis, the bleeding control. So no traditional crushing needed.
Huh, and then the incision.
The skin incision is then left open to drain, much like in a standard open castration, and sprayed with antiseptic. It's typically done with the horse recumbent under general anesthesia.
Fascinating alternative. And regardless of using that or the standard techniques, you mentioned emasculators several times. They sound pretty crucial for bleeding control in the more common methods.
They absolutely are. Emasculators are specialized surgical tools designed to do two things at once. Crush the blood vessels within the spermatic cord very thoroughly, and then cut the cord below the crushed section.
Two actions in one.
Exactly. Provides that vital hemostasis. There are a few different designs. Sarah, Reimer, Whites are common names. For the Sarah type, there's a key rule vets follow. Nut to nut.
Nut to nut.
Yeah, it means the crushing part of the jaw, the nut, must be placed towards the horse's body, proximal relative to the cutting part. This ensures the vessels are crushed before they're cut, preventing hemorrhage.
Ah, okay. Placement is critical.
Very critical. And they're usually left clamped on the cord for a minute or two per side, maybe a bit longer, for older stallions with larger vessels, just to ensure that crush is really effective and secure.
Okay, so the surgery's done, the tool is off. What happens next? It really feels like the post-op care is almost as important as the surgery itself. Is this something owners sometimes underestimate?
I think it can be, yes. It's definitely an area where paying close attention makes a huge difference in preventing complications. Maybe the biggest misconception is thinking, okay, surgery's over, we're done. But really the recovery phase is just as critical, maybe even more so in some ways.
So what's the absolute priority number one after, say, an open field castration?
Exercise. But specifically, daily forced exercise, starting about 12 to 24 hours after the surgery.
Forced exercise, like make them move.
Exactly. Not just turning them out into a pasture where they might just stand around. We're talking brisk walking on a lead, maybe controlled turnout in a small, clean paddock where they're encouraged to move.
Why is that so important?
It's all about promoting drainage from those open incisions. Movement helps pump out any fluid, reduces swelling significantly, and critically, it helps keep the bottom of those incision sites open so they can drain. Prevents fluid or potential infection getting trapped inside.
Okay, so movement equals drainage equals less swelling and infection risk.
Precisely. And for techniques like the Henderson, where the incision is also left open, the recommendation is often even more specific. Forced exercise, say twice a day, minimum 20 minutes each time, for maybe 10 to 12 days. It's that crucial.
Right. What else needs careful watching during recovery? Monitoring?
Diligent monitoring, absolutely. You need to watch for bleeding, a little bit of dripping for the first 12, maybe 24 hours. That's usually normal.
But not a stream.
Definitely not a constant stream or really heavy dripping, or if you see a large blood clot hanging there for more than a few hours. Any of that needs an immediate call to the vet.
Okay. Bleeding. What else?
Swelling. Some swelling around the scrotum and the sheath, the prepuce, is normal. It often peaks around day 3 to 5 post-op. But what you're watching for is excessive swelling. Swelling that comes up really rapidly, or swelling that seems particularly painful or is accompanied by a fever. That suggests a problem.
Like infection or poor drainage.
Exactly. Also, watch for signs of pain. Is the horse reluctant to move? Is there lameness? Any signs of colic? And keep an eye on the incision sites themselves.
What are you looking for there?
You want to see minimal discharge, and it should be serosanguinous. That's sort of thin, watery, maybe reddish-tinged fluid. You don't want to see thick yellow or white pus. Also check for excessive heat in the area, or if the incisions seem to be sealing shut too quickly at the surface, potentially trapping things inside.
Got it. And hygiene must be important too.
Absolutely non-negotiable. Keep the stall or the recovery paddock as clean as possible. Muck it out frequently.
Can you clean the area itself?
Gentle, cold hosing can be really helpful. It can reduce swelling and help keep the area clean. Just be careful not to use a high-pressure spray directly into the incisions. Just gentle rinsing of the surrounding area.
Okay. What about medications? Are they standard?
Pretty standard, yes. Antibiotics are often prescribed for maybe 3 to 5 days, especially after field castrations, just as a preventative measure against infection. And NSAIDs, non-steroidal anti-inflammatory drugs like phenylbutazone, or Banamine, flunixin, meglumine, are very commonly given to manage pain and control that initial swelling.
And the tetanus shot we already covered.
Crucial. Can't emphasize that enough. And finally, usually about 12 to 24 hours of stall rest right after surgery for close observation. Then you start the exercise program. And of course, fly control is really important in the warmer months. Fly sprays, clean environment, maybe fly sheets if needed.
Okay, that's a comprehensive post-op plan. But even with the best care, things can sometimes go wrong. It is surgery. What are the main complications owners should be aware of so they know when to make that call to the vet?
Right, it's important to know the warning signs. So, number one is probably hemorrhage, significant bleeding. As we said, more than just dripping. It can happen if the crushing wasn't adequate, maybe the horse had unusually large blood vessels, or perhaps the emasculators were removed too soon.
And the fixes.
The vet needs to intervene. They might need to resedate the horse and reapply emasculators, or in some cases perform surgery to find the bleeding vessel and tie it off, which is called ligation.
Okay, bleeding. What else?
Excessive swelling or edema. Again, some is normal, but too much usually means drainage isn't happening properly, often because of not enough exercise.
So the fix is usually more exercise.
Often, yes. Forced exercise is key. Cold hosing can help too, along with NSIs for the inflammation. In really severe cases, if fluid is clearly trapped, the vet might need to gently reopen the skin incisions to allow it to drain out.
Makes sense. Then there's infection. You mentioned it's more common in field settings.
It is, just due to the less sterile environment. Or it can happen if drainage is poor and bacteria get trapped. Signs would be a scrotum that's very hot, painful, severely swollen, maybe discharging pus. The horse might have a fever, be lethargic, or even lame if the infection is causing significant pain.
Treatment.
Antibiotics are essential, ensuring good drainage is reestablished, sometimes flushing the area, and continuing with NSIs. And our sources mention a couple of more serious infection types too. One is septic funiculitis. That's a chronic, nasty infection of the remaining stump of the spermatic cord. It often forms an abscess, sometimes called a Sero's cord, and usually requires further surgery to remove the infected tissue.
Wow, okay.
And the other really serious, though thankfully rare, one is peritonitis infection spreading into the abdominal cavity. That's life-threatening and needs aggressive, intensive hospital treatment.
Definitely things to watch for. What about that emergency you mentioned earlier, evisceration?
Yes, evisceration or eventration. That's when abdominal contents, usually omentum, which is fatty tissue, but potentially even loops of intestine, actually protrude out through the castration incision.
That sounds terrifying.
It's an absolute emergency.
Yeah.
It's more common with those open castrations and in certain types of horses like foals, ponies, drafts, those prone to wider inguinal rings.
What should an owner do if they see that?
Call the vet immediately. While waiting, try to keep the horse calm. Prevent the tissue from getting further contaminated or traumatized if possible. Maybe support it with a clean, damp towel, but prompt veterinary intervention, often involving emergency surgery, is critical for any chance of survival, especially if intestine is involved.
Okay, vital to know. Now, what about that proud cut phenomenon, persistent masculine behavior? You touched on this. It's not always what people think.
Exactly. This is a really interesting point and often misunderstood. People hear proud cut and assume the vet left a piece of testicle behind. And sometimes that is the cause incomplete removal, maybe a misretained testicle in a horse thought not to be cryptorchid.
But not always.
Not always. Our sources are clear that especially in stallions gelded later in life, These masculine behaviors, aggression, herding, mounting, can be learned behaviors that persist even after the testosterone source is completely gone.
So the behavior is there, but the hormones aren't.
Correct. It's ingrained habit. So before assuming it's a surgical error, vets can run blood tests to measure hormone levels like testosterone or AMH. If those are baseline low, then it's likely behavioral, not remaining testicular tissue.
Fascinating. That changes how you'd approach managing it.
Completely. If it's behavioral, it's about training and management, not more surgery.
Okay, one last complication mentioned. Hydrocele. What's that?
Hydrocele, sometimes called water seed. This is usually a much later complication, appearing months or even years after castration. It presents as a soft, fluid-filled, non-painful swelling in the scrotum. It happens when a small section of that vaginal tunic wasn't removed during an open castration, and fluid produced by the lining of that tunic remnant accumulates over time.
And the solution?
It's generally cosmetic, but if it gets large or bothersome, the treatment is surgical removal of that remaining piece of tunic.
Okay, so wrapping this all up, what's the big takeaway for our listeners? It sounds like equine castration, when done, right experienced vet, good technique, careful aftercare is generally safe and effective. But clearly, there's a lot more complexity under the surface than many people might realize.
Absolutely. I think understanding those pre-op checks, knowing a bit about the different techniques and why one might be chosen over another, and especially understanding how critical that post-operative care and monitoring is, that really empowers you as a horse owner or anyone involved with horses. It really underscores the importance of being observant, following instructions carefully, and crucially, knowing when to pick up the phone and call your vet if something doesn't seem right. It truly is a partnership.
It really does make you appreciate the blend of, well, art and science that goes into veterinary medicine, doesn't it? So here's something for you to mull over thinking about everything we've discussed. How might the specific temperament of a young colt, maybe shy versus bold, and its intended future use, say, a quiet trail horse versus a high-performance athlete, influence a vet's decision on castration technique? Especially considering those trade-offs between standing versus recumbent, open versus closed, and even those learned behaviors we talked about. That's all for this deep dive. We hope you feel much more well-informed about equine castration. We'll see you next time.